We have PKD Nambiar, policy analyst on the program and commentator. Welcome to the program. PKD Nambiar, let's make it not about Uttar Pradesh, so you don't give me your standard response that you are only focused on Uttar Pradesh. I'm focused on Uttar Pradesh for a reason. This is where we have seen the mass graves. This is where we have seen the abandoned bodies. This is where we've seen the floating corpses. And this is where the state is congratulating itself on a job well done. And that is what I find problematic, because the data that they're putting out on the deaths is so problematic. But I will say to you that the deaths are being undercounted in Delhi, the deaths are being undercounted in Mumbai, the deaths are being undercounted in Surat, the deaths are being undercounted literally everywhere, everywhere. Now talk is in Indian. Let's not get into one state versus the other. How do you feel as an Indian about the dead not being counted?
Barkha, I agree with you 10%. There is no doubt. There is not even an iota of doubt that there is underreporting of COVID. There is the number which has been showing in the government data is way lower than the one which we all can imagine that what has happened. We all have lost somebody or the other in the either in the family or in the close one. So we will never be able to believe the data of a 3 lakh people have only died in the last 1 year or so in India. But having said that, that is one aspect of it, because I'm also from the background of a data person, of a software person. I believe the data is very, very crucial in policy making, and also from the point of view of understanding the real challenges. But one thing, on the contrary, but I also feel that we are not like any other country. We have a lot of legacy issues in this country. We have never, as a country from the last 70 years or so, we have never looked at health as a primary concern or a primary sector to be focused. We are a country of 135 crore people, which is not even a match to any other country other than China. So our challenges with regard to data is data and data collection. And we are also a very big, large democracy. The side effect of democracy is also these data, because these can be fudged at every level, from a panchayat or a gram panchayat to a municipality to a district to a state and to the coming to the national level. These data are not at all coming accurate, which is a very well-known fact. And most of the time, the governments, both at the center and the state governments, have also, to a great extent, accepted that these data may not be as accurate as we are all talking about. But having said that, now I'll tell you the real challenge. Now, let me tell you that we say that we have got how many million people or 100 million people have been infected with this virus. But it may be true that there may be much more. There is, as you said correctly, the underreporting. How many people have really gone for an RT-PCR test? So when the tests are alone not happened, how do you even clearly say that?
There are no tests available. There are no PKD. There are no testing. There is no testing facility in the villages.
Absolutely.
They have to go to the local, find the closest district hospital. Most of them don't go.
That is precisely I am saying you. One, today's data, what we are seeing is the hospital death wherein a person who is a COVID patient who is dead in the hospital, that is the only one which is documented. I'll give you one example, and please don't take this number which I am saying is an accurate one. In the first wave in Delhi, the data which the government of Delhi has released versus after 6 months, the municipal data, which you say that both the 3 municipalities where the death records are mentioned, I was told by somebody that it is more than 20,000 more. So is that all those deaths are actually because of COVID? How many deaths are happening because of the comorbidity? How many people have died even after having the post-COVID symptoms, heart attack, kidney diseases, or because of other stuff? So the challenge of India is not very simple to be discussed in a policy discussion or a panel. But I strongly believe the people like you must question, people like all of us must question, so that at least somewhere it is heard, and even if a small correction will bring a lot of justice to the people who lost lives. That is where I agree. But I wanted to really say you one thing, that let's not compare ourselves with any other country. Many other large countries have failed, like US, Italy, and so-called even the Britain have failed miserably when it comes to COVID management or a pandemic management. I think we have also equally failed. Every state government to the central government have failed every citizen in this country. And all of us, including you and me, has also failed in the fight against the pandemic. So I believe the data is very important. And one more last thing which I wanted to say, there is also a speculation.
PKD, last words. PKD, can we unmute you, please?
I agree with all the doctors in the panel that, of course, data is very important, and we have been very, very poor in creating a credible data at every level. So it's not about to one government or another government. We have failed. But one thing I wanted to tell you, because there is also even in this discussion, there is something has come up that even deaths are not accounted in this country, which is not wrong, which is not right. We are saying that 95 to 98% of our population is now a part of a UID, that is the Aadhaar card. That means every death will be, I would say, 95 or 90% of the death will be documented, and this data will come. But the challenge is going to be, Barkha, is going to be, is these all these people who have died, have they died because of COVID? Have they died because of this pandemic? That data, I believe that I'm afraid we may ever be able to come up with the true data. There is no doubt. But let's not create in such a way that we do not have any system in place. Today, for an example, we have bank accounts. The number of bank accounts in this country today, or in the UID people, all these people are, these deaths and births are today documented in this country much better than ever. Much better than ever.
I see what you're saying, but the problem is, and I'll just give it to Stuti and Yamini after that, is that when the test doesn't happen, the death certificate will give some other cause, even though it's COVID. So we have come across family after family where the doctors verbally said COVID, the symptoms are all of COVID, but there's no RT-PCR, so there's no COVID on the death certificate.
Absolutely,
right?
absolutely.
So that's
COVID number. COVID numbers, you will never be able to get an accurate data in this country because there is no scientific method of.
There's not enough testing.
Not talking about even testing. Even some of the tests, I know somebody who had died, they have got the COVID negative, but actually the second test it was positive.
Okay, I'm out of time.
You could measure excess deaths from last year, and that will give you an idea.
That is the only way of indication. That data will come after a year, maybe.
Okay, so thank you very much to our panel and to our audience. We'll see you tomorrow with another report from literally Ground Zero. So see you there.